I don't know.
Sorry, everyone. Did it work, Ishan?
Yes, it works now.
Okay.
It's recording now.
Oh,
Wonderful.
perfect. Okay. So thank you so much for coming today, Dr. Spencer. We're really, really happy to have you here. And I guess the floor is all yours right now.
Okay, so what would you like me to talk about first?
I think that you could talk a little bit about medical school, like the different journeys that students usually take. The application process. I know you work in the admissions office, so maybe you could talk a little bit about that, what you like to see when students apply, maybe. I don't know if you're allowed to say that, but
Sure.
you could if you want.
Yeah, so so I don't work with the admissions office. I do interviews for them and things like that. So I'm actually not on the official admissions committee, but I do a lot of interviews. Occasionally, I'll review secondary applications and things like that. So obviously, through the first, the initial process is when you're all applying, and you have to submit your GPA, your official transcript, your MCAT scores, and things like that. And that's kind of the first hurdle to get you through the process, right? So all of that, volunteering, volunteering efforts and things like that. That's what's usually in the secondary application process. So whenever I get to review some of that stuff, I'm not really looking at your GPA or any of that stuff anymore, because you've already cleared that hurdle to get to me. When I'm looking at secondary applications, I'm looking at personal statements, letters of recommendation, like all sorts of volunteer, things that you've done, or, if you had a job, say as a scribe or something like that in an emergency department somewhere. Those are the things that I kind of all weigh when looking at this stuff. And I will say though, when it comes to the personal statement, I know, like there are tons and tons of websites out there for you guys to kind of sift through, and they'll all give you different kinds of advice. And the one thing that they always say, which I got to say, I hate it so much, is when they're talking about, try and like be almost poetic about it, and try and like, grab the reader instantly. And it always starts out something like, whenever I get a secondary application and I read the personal statements, like it always starts out with something like, it was a dark and stormy night when I was, in Honduras during some sort of mission. And I'm like, oh, come on, really? Like, you're not Robert Frost. Don't try to be a poet, okay? Just tell me who you are. I want to know you, because that's not real to me. That's you trying to write something that isn't who you really are. And the reader, we're relatively intelligent people. We can actually tell when you're trying to fluff it up, versus just tell me who you are. Be honest with it. Tell me why you really care about medicine. Medicine is hard. It's not an easy thing to do. Medical school is hard. It's one of these things where I just want to know that you're sincere enough with yourself about wanting to do this. You really understand the rigors ahead. You understand that there are challenges that are going to be there, and you're going to have some bad days, and you're going to have some great days. But that you know that you personally can handle it. Those are the kinds of things that I'm looking for when reviewing things like personal statements and applications. A lot of medical students or potential medical students, what they do is they have what's known as a gap year. So because it's really important to get a lot of volunteering experience, because that's really what puts you, head and shoulders above everyone else. So that gap year can be anything from, and sometimes people take more than 1 year, that's okay. But that gap year can consist of volunteering, shadowing physicians, volunteering for, Doctors Without Borders or the Red Cross or something like that, Habitat for Humanity, working for a living as like a scribe or something like that, or working in a lab if you can to get some research and get some publications out of it. Especially here in the DC area, there are lots of opportunities with places like the NIH. And even, of course, here at GW or at Georgetown or Howard or something like that, where you can potentially join somebody's lab to kind of get that kind of experience. but usually that's why most medical students in today's world, they don't go straight from undergraduate into med school. Now they have to take this gap year to kind of fulfill a lot of these things. Others do things like, say maybe their GPA, their undergrad GPA wasn't the best in the world. So they want to kind of allay any fears that the admissions committee has by, beefing that up and doing something like maybe getting a master's degree or doing a post-bac program or a certificate program. I see a lot of students coming in now with an MPH, which is a master's in public health, which is a really good idea, and especially here at GW, if you ever have a thought to apply here for med school, we have a great public health school, the School of Public Health, the Milken Institute, and a lot of our program, a lot of our curriculum is kind of geared toward public health, and it's kind of interwoven into our curriculum. So that's always a nice thing to see. But that gap year can consist of pretty much anything. But it's anything to help you kind of beef up your application though, when coming in. When it comes to things like interviews, again, just be yourself. We know who we're talking to. We know how to read people. We've interviewed enough people in person to see who's really fake and who's being sincere. And it's as hard as it is, just try to relax and try to, breathe and just be yourself. It's just important to be honest with the interviewer when you're talking with them. Of course, always try to be as professional as possible. I'm not a big fan of thinking of professional attire, but nonetheless, you should probably dress nice. Coming in ripped jeans and a tank top, that's not exactly professional. But nonetheless, just make sure you're presentable in that kind of a respect. But yeah, that's pretty much it for the admissions process. Do you have any questions about that?
Actually, I do have a question. So do you recommend taking a gap year, or it's something very personal?
That's honestly up to you. Like I said, if you're fortunate enough to be able to get a lot of these opportunities and be able to do them, say like over the summers, in your undergrad time, then go for it. If you want to just continue to plug away and just jump right into it, then I say do it. If you're truly ready for that. But that's really up to you. Again, mostly the gap year is for people that need to kind of fill up their resume, before sending it into the med school. But if there's no need, if you happen to be, if you're nailing like a 520 on the MCAT, and you've got all these experiences, and you even got a couple publications out of the way as an undergraduate, then yeah, by all means, go ahead and apply to Harvard. Go for it. But it's really up to that individual person.
Yeah, that's true. So does anyone else have any questions in regards to the application process and the interview? You can think a little bit about it. You can put it in the chat. We can ask them right now, or we can ask them a little bit later as well. But yeah, you can start brainstorming some of the questions that you may have. And I do have another question, but it's more, so I talked to you a few days ago, and I mentioned how medical school is very different from college. GW's is. And I have a friend who's a medical student there right now, and she was explaining to me that their courses aren't a semester-based, like academic year. So it's more a few weeks of studying something, a topic, and then later on you have a different topic. Could you explain that to us a little bit?
Yeah, sure. So one quick thing though about the application process. Some of you might be thinking, well, how do I go about applying? Like there are so many medical schools. How do I choose one? And that's a really good question. That's an important question to ask. And one of the things you want to do is look at, its location. Where is it? Go on their website and see what their stated mission is. Their mission, their vision, their values. there are a lot of places that are, before I came to GW, I worked at Central Michigan University's College of Medicine literally in the center of Michigan. And their focus is mainly on primary care and putting physicians in underserved areas, not necessarily underserved, urban areas, but underserved rural areas where, like the Upper Peninsula of Michigan, there's like 4 people there, but nonetheless, they still need healthcare and they're hours away from it. So what they need to do what they're focused on is trying to put physicians in those kinds of places. That's different from GW. GW is not really focused on primary care. They're focused more on specialties, emergency medicine, surgery, things like that, rather than just family medicine. So you have to think about, you don't have to decide what kind of doctor you want to be, but you have to decide, how do you see your future kind of panning out? So it's important to kind of think of some of those things. So I see we have a question in the chat here. It says, if we don't have as much research or volunteer experience as we would like to have, primarily because of the pandemic, is it a better option to take a gap year, or can we still apply this on time with little worry? That's a good question. The process now for the admissions process and all that stuff, and for people that are trying to take these, trying to beef up their resumes during the pandemic, has obviously been challenging. I haven't spoken directly with the people in the admissions office here about how they're going to view that on how they're going to view that for the next cycle of applications. So it's hard to say, but honestly, you really should have more. It's more than just your GPA now. We're really trying to split hairs here, because there are so many people that are applying to medical school, and everyone is coming in with kind of the same kinds of grades and same kind of MCAT scores. So we need something else to kind of judge you on. So the more experience that you have, whether it's research or volunteer or both, which would be nice, those are things that you really want to kind of look for. And research, especially during the pandemic, is hard. It's hard to do. Like here at GW, there are no undergraduates that are allowed on campus in anybody's lab, so research is kind of shot for that. But there are volunteer experiences that you can do, volunteer opportunities that you can do with local groups, and it doesn't have to be even medically related. It could be humanity related. So things like Habitat for Humanity. Trying to help out in those kinds of areas are really important, and they go a long way when the admissions committee is looking at your application. There's another one that says, what's the threshold a student should aim for to pass the GPA hurdle? Well, that depends on the school. Obviously, you want above a 3.0 for any school, really. But depending on the school, if you're going to Harvard, then if you want to go to Harvard or an Ivy League like that, yeah, you want a 4.0. You want beyond that, in fact. But here at GW, we're usually looking at like kind of the 3.7, 3.8 range, which is really high. But if there are people that are below it, say people that are a 3.5 or something like that, that's okay, as long as you have those other kinds of experiences, the important experiences. And that's where a gap year would come in, to really help you out to try and get into GW or most places like that. We have a list of 25 virtual volunteer opportunities that we can send you when you go. Oh, there you go. What was the most memorable interviewee you've had? That's a good question. Actually, I was just talking to one earlier today, and he was a nice guy. He actually just moved to DC, and he's going to be volunteering at the NIH, getting some experience during his gap year. But it was interesting in that he went to Vanderbilt University, and in early March he actually got COVID-19, and he said he was one of the first 5,000 cases here in the U.S. confirmed cases of COVID-19. And he said it gave him, and he was sincere too. He's not one of these people. He didn't come off as one of the people that was like, trying to use it as an excuse to beef up his interest in medicine. He was like, it honestly changed he's like, I knew I wanted to go into medicine, but it kind of changed a little bit of how I saw myself as a future doctor, knowing that I was going down this path and then having to be treated by this. And he's like, I was able to he's like, thankfully I wasn't like heavily symptomatic. He did have a few symptoms, but he did all the necessary precautions and stuff like that. But he kind of used it as more of a reflection on himself to understand what it's like to be, what it's like to be a doctor and be a patient as well, and to try to understand that. But I mean, I've had a lot of, that was pretty memorable just because it happened, a couple hours ago. But I mean, I've had a lot of students, share with me some deeply personal things that have happened to them, because the first question I always ask is, why medicine? It's hard, it's going to take a lot. What is it about medicine that makes you want to do it? And that's where I get these, candid answers. And, some people, they share some really tough stories about, they had a brother who, who was diagnosed with cancer, when they were young. And unfortunately, the brother didn't make it, so they had to, but they were impressed by how the healthcare team that was taking care of him and taking care of his family, how they treated him. And, things like that are always, they're always memorable for me. But yeah, that's a good question. I've had quite a few memorable ones. I had one negative memory that I had when I was doing this at Central Michigan's College of Medicine. I was doing interviews, and it was kind of a different way to interview. So here at GW, we do the standard kind of interview, which is, I sit down with you for a half hour and just talk and ask you questions. But then there are other ways to do interviews. They're called like multiple mini interviews, MMIs, where essentially you meet with a different person for about 5 to 7 minutes, and you meet with like 6 of them in a row. And you're not really getting interviewed. You're asked to do weird things. You're asked to do like kind of tasks. One, for example, is so I'll have a shoe in front of me that's untied, and I'll tell the person their job is to direct me how to tie a shoe. Pretend like I've never tied a shoe before in my life, and tell me how to tie a shoe and see if it works. Now, the reasoning behind this, it sounds really stupid and goofy, right? But the reasoning behind this is, as a doctor, you have to be incredibly explicit on how to tell a patient how to care for themselves once they leave your office. Sometimes simple thing like just taking medications, at a certain time is really important, and people don't necessarily get that. So you have to be explicit, and you have to be understanding without being frustrated if they fail. And I got to tell you, man, I learned some crazy ways on how to tie a shoe. Some people do it in completely bizarre ways. But there was one time when I had a student, I forget what the activity was, but she came in and she knew the scenario, what she was supposed to do. And she said, hey, I'm not going to do that. And I was like, excuse me? And she's like, I'm not doing this. This is stupid. I said, okay, well then have a nice day. You can wait out in the hall. And that was done for me. And apparently she did that for a couple other people that were interviewing her too. So we were like, yeah, forget that one. So yeah, I've had some pretty memorable ones over the years, but good questions. All right, so let me get back to what Natalia was asking about the curriculum and how it's set up. So medical school used to be, where, gross anatomy, which is what I do, what I teach, gross anatomy was a class that you took in your first semester of med school. And then, biochemistry was a class, pharmacology was a class, and that's kind of what you guys do now in undergrad. That's not the case with medical schools now. Most medical schools, they've shifted over to what we call an integrated curriculum. So, for example, I teach throughout the first 2 years of medical school. Medical school is always set up in that you have the first 2 years of med school, which is what's known as your preclinical years or pre-clerkship years. And then the last 2 years, years 3 and 4, you basically go into the hospital and you're doing rotations. Those are the clerkships or the clinical years. But the preclinical years, what we've done is, and this is true for just about every medical school you'll see now, they've integrated the curriculum so that gross anatomy is not just one class that you take in one semester. Now it's threaded throughout the entire 2 years in what we call organ systems courses. So usually, like what we have at GW, and it's also what I did at Central Michigan, what you'll see is the first semester is usually 1 or 2 courses in that first semester. And they don't run at the same time. There's one course that you take from August to, say, October or mid-October or something like that. And then there's another course that goes from mid-October to December. And usually they're based on the foundations of medicine. And here we actually call it Foundations of Medicine. When I was at Central Michigan, we called it Foundations of Medicine as well. And that's where you get, you know, kind of the intro to genetics and intro to biochemistry and intro to anatomy and, you know, intro to physiology and physiological concepts and things like that. And then you kind of get a brief overview of what the organ systems are. So an organ system, for example, would be the cardiovascular system or the pulmonary system or the renal system for your kidneys or the gastrointestinal system. Or the musculoskeletal system, which is, you know, basically the musculature and bones and joints of your body, as well as the peripheral nervous system that controls them. And then there's the neuroscience system, and, you know, on and on and on, the reproduction system and so forth. These are the courses that you start to take usually beginning in your second semester of your first year. So here at GW, we actually combine several of these systems into one course. We call it our CPR course, cardio, pulmonary, and renal course, because those three systems, while they seem kind of different from each other, they're heavily physiology based. And so you need to understand physiological concepts to take them. And that's where, you know, that's where I'll come in and teach some stuff in anatomy. I'll teach about the heart anatomy and the lung anatomy, as well as kidney anatomy, anything that's kind of in the thoracic region or related to those things. So you start to stem out into the peripheral blood system of, say, the arm or the leg, or even the gastrointestinal tract. But I'm just teaching the anatomy portions of that. There are other people that come in and do things like that teach the physiology concepts, the physiological concepts. So these are the physiologists. You'll have people from pharmacology that come in to talk about all the drugs that impact it, you know, so things that control things like blood pressure, and you know, those kinds of things. Then what we have here at GW, the next course after that, so once the cardiopulmonary renal course is over, now students start on the gastrointestinal course. So it's mostly, so we'll come in and do the anatomy of the abdomen, talking about, you know, the intestines, the stomach, you know, liver and all that stuff. But that's our little portion of this course. The physiologists will come in and talk about the physiology of the GI tract. Of course, clinicians also coming in from the hospital that come in to talk about kind of common complications that you might see and things that you should be prepared for. And of course, pharmacology and microbiology and biochemistry, they all come in to talk about how this is all working. And it's mostly to kind of get at the idea that, you know, these systems don't exist in a bubble, right? You know, you can't just think about anatomy as just anatomy, and then pharmacology is just pharmacology, and biochemistry is just biochemistry. All of this, you know, kind of interweaves. For example, when I get into, so I'm one of the course directors for our musculoskeletal organ system, which is the first course that the GW Med students take of their second year. So we actually just got done with the course today. Today was the last day of the course, the musculoskeletal course for my second year med students. And one of the things that I do is I work a lot when I'm doing the anatomy, going through the anatomy, I work a lot with our neurology clinicians. So the neurologists will come in and we'll kind of have discussions and things like that, where I'm talking about the nervous system of, say, the upper limb. There's this thing called the brachial plexus that kind of controls the upper limb. It's my favorite thing to talk about, and Natalia can tell you all about it because I beat it into her when we were taking the gross anatomy class. But you can imagine, Natalia, how much more in depth I go with the med students. Just because of how important it is. So, but you know, the reason why I'm talking about this is because it's important to understand that kind of anatomy, because then as a neurologist, when the neurologist comes in and sees a patient that has, say, you know, their arm is kind of held in a certain position, the neurologist can kind of localize that without even doing any tests right away. They can kind of focus in on where those tests should be performed, because they can tell just by the presentation of the patient. You know, if the patient has you know, their arm, their shoulder is completely what we call adducted, the arm is against the body, their elbow is straight out, and their hand is kind of turned over and pronated, right? So they kind of, it's what we call waiter's tip palsy, because it looks like a waiter trying to get a good tip for seating you at that really nice table, right? So he wants that tip on the DL. You know, by seeing a patient walking into your office that way, a neurologist can think, all right, there's something wrong with the upper trunk of the brachial plexus, because the nerve fibers that run through that upper trunk, they control the muscles that aren't functioning right now, and that's what's causing your arm to kind of twist in this kind of position. And so, I'll talk about the anatomy, and then the neurologist will come in and say, and this is how I know what the anatomy that Spencer was talking about, how it relates to it. And now I can use that to kind of localize and focus my test, so I don't have to run a whole bunch of unnecessary tests, waste a whole lot of money, trying to run these unnecessary tests. Now I know what I should be looking for. So, these are kinds of the things that we look to do now with these integrated courses. So, once you're done with then the musculoskeletal course, then we go into our neuroscience course. And neuroscience, what we call brain and behavior. So it's neuroscience and psychiatry, because obviously they're tightly intertwined with each other. So it's important to note, how all of these things work together, because they're not in isolation. And it helps to build the foundational knowledge that the students need for their first 2 years to, first of all, take the first part of the board exams, which is called Step 1 exam. And that's what students usually take after the first 2 years of med school. And then they move on to years 3 and 4 when they're in the hospital and they're on the wards and they're doing these clerkship rotations. So they're rotating through a surgery rotation, an emergency medicine rotation, an OB-GYN rotation, usually some kind of family medicine or internal medicine rotations, and things like that, psychiatry rotation. But we're trying to give them the tools in the first 2 years so that they can get on the wards in years 3 and 4 and start to know, basically start to play doctor before they're officially a doctor. So those are the things, that's kind of what the curriculum is. I hope that answered your question. I know it seems weird, but every medical school that you're going to apply to is going to have that kind of a curriculum. Every MD granting medical school will have that kind of a curriculum, because I'm sure most of you know that there are two types of medical doctors, right? The MD degree, which is what we are here and what's most commonly seen, but there's also a doctor of osteopathic medicine, a DO. And it used to be that people, for whatever reason, always thought that DOs were somehow less than MDs, and that's just not true. They're basically they're filling the same kind of residency spots and things like that once they graduate. So a DO and an MD are pretty much the same thing. So if that's a path that you might think about wanting to go down, that's perfectly fine. Now, because of that stigma, though, that still exists, even though it's not true, you'll see people that don't have as good, an academic record as some others going the DO route rather than the MD route. So that's one thing to consider. So I see it says how much does science GPA matter if the regular GPA is very good? So that's a great question. So usually we do take a pretty good look at the science GPA, especially if the overall GPA is, say, a little low. Then we'll look at the science GPA. If the science GPA is really high and the normal GPA is a little lower than what we would like, that'll probably be okay. That'll probably be enough to kind of push you over. If the converse is true, if the regular GPA is really high and the science GPA isn't so high, that could hurt you, but I wouldn't say too much just because your overall GPA is better. So we might not, it's just one of those things where we might not look at it as closely just because your overall GPA is really, really good. But like I said, but if you have a really high science GPA and your overall GPA is a little low, that's definitely a help for you. But it kind of gets back to what I was saying, though, with different kinds of programs, different kinds of med schools. So the allopathic medical schools, which is what we are, which is what, those are the schools that grant MD degrees. I think there's like 150 of them in the country. And you can go on, there's this committee, national committee called the Liaison Committee for Medical Education, LCME. It's lcme.org. If you go to their directory, you can see all of the schools they're the accrediting body. So you can't offer an MD degree if you're not accredited from the LCME, at least in the US and Canada. There are other schools, obviously, internationally that have their own rules for things like that. There's another committee that kind of oversees the accreditation for, thanks, lcme.org. There's another one, and I forget what the name of this one is, but it's the accrediting board for the DO schools. But again, it's the same kind of degree. However, if you're concerned about your GPA and you don't think that you're going to get into what you want to get into for an MD granting school, typically DO schools will have a slightly lower bar. Again, that doesn't mean that there's anything wrong with those schools. You're still going to get a great education. It's just they focus on what's known as osteopathic medicine. It's kind of, I don't want to say holistic because that sounds like it's, you know, like acupuncture, and that's not what it is. It's rooted based in true science, and it's good. It's just they do more kind of manipulations of the body first, rather than going straight to drugs. So I'm sure some of you have even seen a DO without even realizing. You just went to the doctor's office and you just, you know, didn't pay attention to the degree on the wall. But if you look, it says DO instead of MD. But if anyone's ever had, like, say, appendicitis or something like that, and you went to a DO, they might, rather than just kind of pushing on your belly, they might also kind of take your right leg and kind of bend it up and bend it down. They're looking for a thing called the psoas sign, which is just kind of manipulating the body and how the appendix moves, and how it can kind of, you know, cause this kind of pain when that function happens. So they just do things a little bit differently, and that's how you get taught at a DO school. But again, there's really no difference, honestly, between a DO school and an MD school in this day and age. You're getting the same kind of education, and you're still going to be pretty competitive, you know, with when it comes to applying for a residency job. So just keep that in mind. If your GPA is not what it should be, what you think it should be, you know, there are plenty of other opportunities rather than just the 150 or whatever it is MD granting schools. There are the DO schools that are out there too. So, any questions on that?
Yeah, if anybody has any other questions, feel free to shout it out or just type it down as well. I do have a question, and I think some other people might have thought about it too. What is the admissions view on shadowing experience? And especially now, I know that there's a lot of virtual shadowing opportunities. Do you think that medical schools are going to like seeing that, or do you think that it doesn't influence as much in your application?
Well, so shadowing opportunities are always great. It's, you know, I think it's important for you to be able to get out there, because it's something that you can, I mean, it's one thing to just really know, do you really want to do this? You know, it's something that you should certainly strive to get just for your own personal, you know, personal benefit of that. When it comes to the virtual shadowing, so it's what we're calling like telehealth now, or telemedicine. I don't think that that's going to be considered. I don't think that's going to be looked down upon because, I mean, the situation is what it is. That, you know, we can't control that. But at least you're showing the effort to try and get out there and, you know, and do something with it. And it's still important because, you know, even so, I mean, you know, a lot of the patients that our clinicians here are seeing now they're seeing it virtually. They're seeing these patients virtually. And which means that even our third and fourth year students who are, you know, doing these rotations, these clerkships, they have to participate in this. And that's really the only experience that they're getting in some instances. They're still seeing regular patients as well. But for most people, if it's just, you know, hey, I've got some, like seeing neurologists, for example, saying, you know, I've got, you know, issues with my pinky finger, and, I'm just a little concerned about it. Is this something that I need to come in for? And the neurologist will have his telehealth visit first and just do some, you know, kind of tests and things like that the patient can do to elicit pain or not elicit pain in that particular reason. And then from there, they can say, no, actually, I think you're fine. I can write you a prescription, and, you know, you can, here's some, you know, some sort of, NSAID or something like that, like ibuprofen. Just make sure you take, you know, you can go get that filled at CVS, and then you're good to go. If it persists, then we'll have another visit virtually, and then we can decide whether or not you need to come in. But you know, that's the neurologist talking to their patient, but that's also the student, the year 3 or 4 student sitting next to them, essentially, you know, virtually, watching this and participating in this interaction as well. So, you know, even though they're not seeing the patient in reality, in person rather, this is their reality now. So, like, you have to get used to telehealth now. And I think the pandemic has kind of forced, you know, medicine's hand a little bit, in that telehealth, which already existed, this was something that we had already done previously, just not on a large scale like we're doing it now. I think it's actually going to be beneficial, though, for the healthcare system, in that more people are going to have these kind of telehealth visits to kind of cut down on unnecessary visits to a doctor's office, which can cut down on things like, how much copay you have to, dole out for your insurance and stuff like that. I mean, you still have to pay nonetheless because you're taking up the physician's time, but it could cut down on unnecessary expenses, which I think is certainly a good thing. So there's a question here that says, does in-person shadowing have more value than telehealth shadowing during the pandemic? I think in-person shadowing, regardless, is always going to be more beneficial because you get to, there are just, nonverbal clues that you pick up from not only the physician that you're shadowing, but from the patients. And really the shadowing is just as much about you understanding the patients as it is you understanding the profession. There are just so many different ways to go about it. But that doesn't mean that the telehealth shadowing isn't important too. As I mentioned, I think it's something that's going to become more and more of a thing now in medicine. So I think it's something that you should certainly get used to, because it's different, right? We've all been doing this now for several months, and we're all tired of it, of course, of doing this virtual thing. But at the same time, we're also getting used to it in a way, and knowing that there are certain things you can and can't do, via virtual connection, that wasn't necessarily true, for in person. So it's important to get both, I think, especially during the pandemic. But anything that you can do in person is certainly going to be incredibly beneficial. And I would say it's more so than telehealth, but you still have to understand the telehealth too.
Yeah, there is a really good virtual opportunity it's British. And we have a list of virtual shadowing opportunities that you can get from us during our office hours, but I'll send you the link to one of them. For me, it was the best one. It's 12 euros. It's the only paid virtual shadowing opportunity that I found. But it's really, really good. It's almost better than in person because they zoom in during the surgery. So you get to see a lot more than you would if you were in person. And in addition, the doctor sometimes stops the surgery and talks to you to make you reflect and then look back to your personal statement. So it's really good in those ways. And I'll send you guys the link. It's right in the chat if you want to see it. Yeah, the only problem is that it's paid, but other than that, it's really good. Yeah, if anybody has any other questions, feel free to type them out. So Dr. Spencer, I should have asked you earlier, but would you like to introduce yourself to all of us? So your career, your experiences. I don't know why I didn't ask that earlier, but yeah.
Yeah, sure. So halfway through this whole thing, sure. So again, my name is Mark Spencer, and I apologize. I should have done that too. That's just weird, but so my name is Mark Spencer, and I'm an anatomy professor here at George Washington University. I'm in the School of Medicine in the Department of Anatomy and Cell Biology. But I will say though that, I've talked obviously quite a bit about my experiences, teaching anatomy and serving, helping the admissions committee and all that stuff. But one of the things that makes me different from everyone else in my department and even in the School of Medicine is that I'm actually, all of my degrees, I have a bachelor's, master's, and PhD in geology. I'm a paleontologist. I work on dinosaurs. I'm a stereotype of a paleontologist. I actually do work on just dinosaurs. But it's, it's one of these weird things that what you're starting to see in medical schools is that historically the anatomy departments, because anatomists take on the lion's share of teaching, anatomy departments traditionally didn't push out a lot of graduate students. There were a few that did, but just because of the incredible amount of load on the faculty, they just didn't have enough time to train grad students. So as older anatomists started retiring, there was kind of this dearth in anatomy faculty, but there were tons of jobs open. So what you started seeing were people like anthropologists and paleontologists like me that started to move into these kinds of departments because we know anatomy. That's our job. Right? I study the bones of extinct organisms, and I know quite well the entire animal kingdom, including humans. And humans, we're kind of bizarre little animals, but nonetheless, every animal is kind of bizarre in its own right. And when I first started down my path to becoming a paleontologist, every little kid loves dinosaurs, right? I just never grew up, so that's just kind of how I became a paleontologist. But when I got into college and got into graduate school, and started thinking about this career, I was thinking, all right, well, I'm going to be a professor at a university, either in a geology or a biology department, or I'm going to be a museum curator. And the problem is, museum curators, first of all, there aren't very many jobs for that around anyway. And once you get that job, you tend to hold on to it for life. So there's not a whole lot of opportunities to do that. And for someone like me in a geology department, geology departments look at paleontologists and think you're a biologist. And in biology departments, they look at a paleontologist and they say, no, you're a geologist. So it's like, all right, I can't win for losing on that one. But what I didn't realize was, once I got to the University of Iowa, where I did my PhD, my advisor, Chris Brochu, he said that he makes his students once they pass what's known as your comprehensive exams that you have to take to get a PhD, he makes you take gross anatomy. And I was like, why? What's gross anatomy? He's like, well, because it just makes you more sellable, once you go out on the job market. Because it's a tough road to hoe to become a paleontologist in an academic department like geology or biology for lots of reasons. But there is a need for people to teach human gross anatomy in medical schools. And at the very least, you can then, say, everything went kind of sideways for you. There are other jobs where you can teach, say, A&P courses at any college, or you can teach them at a community college or something like that too. But you have to have that kind of experience in doing so. So when I started taking gross anatomy, I realized, wow, this is so cool. Like, I never realized, it's weird, right? You cut up dead bodies, but it's so much more than that. You really learn so much about yourself when doing it. And I found out that I loved it. And the amazing, I'll still never forget the donor that I worked on as a student. And she was a 91-year-old woman who she gave her body to me so that I can learn about human anatomy, and that I could learn about who I am. And it was one of the most empowering and humbling things that I've ever experienced in my life. And I don't know who this woman was. I don't know her family, but she gave me the greatest gift in the world. And I've got a wonderful job and I have a wonderful life because of her. I didn't realize that I would have that kind of almost like religious experience, with working on this woman. And I realized that I loved anatomy. I still love being a paleontologist too. And that's the great thing about this job, is that I get to teach human anatomy, which is so much fun, and kind of teach everyone else about their own body. And I still get to work on dinosaurs. So it's like, hey, this is pretty cool. So I had kind of a weird circuitous path to get to where I am, but it's certainly worth the reward that I have now.
It's so unique. It's so different. We have a question in the chat.
Since it's difficult to find in-person clinical and research experiences right now, do you have any recommendations on things to do to get some experience other than virtual shadowing, or just any advice on things to do to prepare for med school during this virtual learning time? I'm trying to think, because I've had a couple of people ask this question to me, and honestly, I don't know. I know it's really difficult to find these opportunities. I know that they're there if you really look hard enough. I know Natalia was able to find this one from the from the UK that was kind of seems like it was pretty rewarding, which is really cool. But I honestly don't have any recommendations right now to think of. But anything that you can try to find the virtual shadowing, if you can find that and it's available, certainly do that to try and get any other kind of experience. Like I said, with research, it's really difficult now because some places like GW here, they're not allowing undergraduates to come in. If you happen to be if you happen to be at home or something like that, and it's not here in the DC area, and you can, you know, find a local institution that might be open, because DC is pretty strict right now with the pandemic rules, but other places aren't as strict. So you might be able to find other kinds of opportunities, whether it's research or whether it's in-person shadowing. You know, certainly try to do something like that. But other than that, I would say, you know, just try and find as many of these opportunities as you can. I know it's difficult, but you know, they are out there. It's just, yeah, you have to look kind of hard for them.
Also, in relation to research, do you think that medical schools view wet lab versus dry lab differently, or do you think that they both influence one's admission in the same way?
I don't think they make that big of a distinction. You know, research is research, and you know, a publication is a publication. So that's, you know, that's the important thing. And I know when you and I had talked a couple of days ago, you had mentioned, you know, trying, you know, depending on the person that you or the people, the group that you're working with, to get the pub out, you know, if this is just kind of like a, you know, almost like a senior thesis or a capstone thing that you've been working on, you know, just look for an undergraduate journal to publish it in, that, you know, that focuses on undergraduate work. You know, that's, you know, you're not looking for impact factor here. You're not looking to get something published in, you know, the Journal of the American Medical Association. You know, you're just trying to get something published. That's it. So even if it's the Journal of Joe's Basement, as long as it's a journal, you know, that's fine. Just submit it there and get it published, and that looks good. Now, of course, if you're working with a whole team in someone's lab, then yeah, you know, obviously listen to them and listen to you know, where they want to submit it for publication, because obviously it's beneficial for everybody. But you know, a pub is a pub when you're just trying to get that first, you know, hurdle over.
Thank you.
Yeah.
Yeah, we
so
also have another.
Yep.
Yeah.
How many publications should we have to be significant? That's a good question. It depends on where you're applying. You know, I don't think any med school has like a set limit or a set like floor on how many you should have to be considered for school. In fact, most places, I would argue most places don't have, you know, you don't have to have any. But if you do have some, if you have one, if you have, you know, three, that's great. You know, getting published as an undergraduate is not an easy thing to do. You know, there's a lot, you know, there's a lot that goes into how you might get published as an undergraduate. So I wouldn't focus so much on the pubs. If you've been in a lab and you didn't get any pubs, but you were on posters, you presented at conferences, that's important. That's research, and that, you know, that counts. That abstract is published technically. So that certainly matters. So if you have that kind of opportunity, even if you presented virtually at a conference, which I have a conference in about a month, my annual vertebrate paleontology conference, and it's unfortunately been canceled, but well, not canceled, but it's moved to a virtual environment. So, you know, we're going to be doing all this stuff virtually, but it still counts. I mean, you know, we need to turn it into an actual publication afterwards. So if you can do that, that's great. But nonetheless, you know, if you present it anywhere and that abstract has been published, include that on you know, in your application. But no, there's no like, you know, minimum limit of publications that you need to be considered for med school. Again, if you're trying for something like Harvard, then yeah, you probably should be published. But I wouldn't consider that you know, a deal breaker for most other schools. What separates top medical schools from regular medical schools? That's a good question, and I honestly don't know. We always, like, if you like, there are a bunch of different fora out there. So like one that I'm thinking of is the Student Doctor Network. If you guys, some of you may have been familiar with that. It's a great place to mine because you have students at each institution. It's basically just a whole blog of people. So if you go on the Student Doctor Network and you go into the forum and you see the chats, there's students that are at the current institution, students that are applying to that institution, trying to find out questions. It's all generally anonymous too. And then you even have some faculty from different places that kind of weigh in on this stuff. And they'll talk about things like, you know, how many pubs should you get? You know, what's good, you know, shadowing experience versus bad shadowing experience. So you can kind of mine that to kind of, you know, see what's out there. But when you're on that that website and others, you'll see things that they're talking about, the, you know, top tier medical schools versus regular medical schools versus low tier medical schools. I honestly don't know what is what. I mean, obviously an Ivy League school like a Harvard and Yale, they're going to be considered premium, you know, top tier medical schools. Stanford, you know, Chicago, those are all top tier medical schools. GW, I don't know where we are. I think we're close to the top. We might be top tier, but I don't know who considers us what. You know, we are a very good school. We're the 11th oldest medical school in the country. We've been doing it for quite a while, so we know what we're doing. So you know, it's kind of hard to you know, discern what exactly is top tier versus, you know, almost top tier versus regular versus lower, you know, who knows. But I mean, you know, there are certain places like, again, the Ivies, Stanford, you know, those places that you're like, okay, those are obviously top tier medical schools. So from your experience, do a lot of medical school applicants send in letters of recommendation from physicians that they shadowed? What should a good recommendation letter have in your eyes? That's a good question. That's a great question. So yeah, oftentimes they'll have a physician that they shadowed send in a letter of rec, and I think you know, that certainly helps us try to determine you know, how this person interacts, how seriously they take it, you know, and really, you know, were they standoffish, you know, were they really involved in it, like how much they really cared about, you know, the interaction that they had. As for, you know, what should a good letter have, the person should know you. You know, and I know that's hard for some people, and that's understandable. It's you know, oftentimes, like, I'll get requests to have you know, me write a letter for someone that's applying for some other program, whether it's med school, you know, grad program or something like that. And typically, you know, it's someone that I've had in class, because I do teach undergraduate classes, and Natalia was in it just this past spring. You know, and oftentimes, though, I only have, you know, that really, you know, one instance to kind of go on. But in that instance, if they ask me, I'll typically try to set up a meeting with them just to see, you know, I mean, like, I'll, you know, I knew who Natalia was, you know, she was a good student in my class and all that stuff. And, you know, we had, you know, met in office hours and stuff like that. So I kind of got to know her better that way as well. So, you know, but nonetheless, I'd still like to see other things. Like you know, I would ask for something like somebody's resume, somebody, you know, what we call a CV, your curriculum vitae. You know, and usually I'd ask them if they had started to write a personal statement, if they could send me that, just so I can kind of see what they're you know, what they're thinking. So that's usually what I do to whenever somebody asks me for a letter of rec, just because I want to know their thought process, and you know, I want to get to know them a little better, so I can write more than just, yes, student X was very good in my class, and they performed in the top 10% of my class, and they, you know, they asked questions. I want to be able to write more than that. I want to, you know, write about who the person is and why they really want to go into this kind of program, why I'm writing the letter for them. So I think that's what a good letter should have is, you know, the person writing the letter knows the candidate at least a little bit. And I know sometimes, again, that's difficult, but even just setting up a meeting to just kind of talk about, why do you want to go into this particular field? Why do you want to go to grad school? Why do you want to go to med school? Something like that. You know, that's something as simple as that kind of informs me about what, you know, who you are. So good. So there's another question that says, does where you go for undergrad have any impact on acceptance? Not in my experience, no. I think, you know, as long as you know, if you have because the biggest hurdle, right, is the first hurdle, which is your GPA and your MCAT. So it doesn't really matter where you went to undergrad, because we're going to be looking at scores. We're not looking at schools, right? So as long as you get past that hurdle, I don't care where you went to school. I don't care if you, you know, and there's nothing wrong with this if you went to community college for the first 2 years and then you transfer to a 4-year institution to finish it off. So big deal. You know, a lot of people do that. And a lot of people do it for a lot of different reasons, not just because they necessarily couldn't hack it or whatever. It could be, you know, personal reasons. Who knows? So, you know, as long as you have that bachelor's degree and your GPA is up there, and your MCAT is up there to where it needs to be to whatever school you're applying to, then that's fine. So no, your undergrad shouldn't have any impact whatsoever.
Thank you. I was going to ask about the brachial plexus if you wanted to introduce it a little bit, but I don't think we're going to have enough time. So you're still teaching human gross anatomy, correct?
Yes.
Okay. So everyone, if you haven't taken that class, it's for the human anatomy minor and it's in the med school. As I see cited, Dr. Spencer is teaching it and he's a very good lecturer. So if you want to know a little bit more about the brachial plexus and all of that, you should learn it from him. He knows how to explain. But yeah, that's a really good class, by the way. Yeah, so I just have one last question, and then I think we can finish in about 3 minutes. So everybody, if you have any other questions, feel free to shout or just type it down. My question is very random, but if you hadn't studied paleontologist, what do you think you would become instead? What field do you think you would go into? Especially if you think that you would have gone to medical school instead, what kind of doctor do you think you would have been?
That's a good question. So, I mean, I've wanted to, like I said, I've wanted to be a paleontologist since I knew what a dinosaur was. So since I was 3, and I realized that you could actually, study that for a job. So I've always wanted to be that. There was a time when I was in high school when, of course, being a science nerd like a paleontologist wasn't cool. So I was like, well, what's a kind of a cool science? Because I love science. So there was a time I was thinking about marine biology for a little bit. But I quickly got rid of that and went back to paleo. I never ever thought about becoming a medical doctor. Just never crossed my mind. It never, it was never something that I was ever interested in. And even now, it's like I teach future doctors, and I interact with doctors all the time. Some of them are my great friends. But I still, I'll let them deal with that. They, that's their gig, and I'm happy that they do it because I prefer not to. But I would say though, and I've certainly thought about this because I've had a lot of med students ask me this over the years is, if you were a doctor, what kind of doctor would you be? And just being, being the anatomist and loving the musculoskeletal system, I would probably be an orthopedic surgeon. I'd be a surgeon of some kind, but I would really like to be an orthopedic surgeon, working on bones and joints and things like that. That's really that's my thing. But if I had to not be a surgeon, I'd probably want to be an emergency medicine doctor, just because, that's just fun. It's scary, and it's it's thinking on your feet, and it's stuff that I think I would really enjoy doing. But
Yeah, thank you. Actually, orthopedic surgery, that's what Adam wants to do, right, Adam? My co-president. Not me, the other Adam. I'm Natalia. The website I showed you guys of the virtual shadowing opportunity, the first thing you can click on is orthopedic surgery. I think there are about 2 or 3 surgeries actually that you can watch, and it's really, really cool. But yes, I think that's it. If nobody has any other questions, I think
thank you,
that's
Alyssa.
for today. Yeah, thank you so much for being here.
Thank you so much.
It was my pleasure. Yeah, if if you want me to come back for another session sometime later to just talk about the brachial plexus, I can talk about that forever. So
Definitely, I think that would be a really good one.
Good.
all right, well,
And yeah,
yeah.
Aruma's right. Aruma is really right. Like you should take human gross anatomy. It's really, really good.
Well, good. I'm glad. I hope to see hope to see a lot more of you in the course, and certainly taking the anatomy minor too. It's certainly a good program to have, and it gives you a nice basis moving on into medical school. So
Great.
but
Okay.
all right.
I think that's it for today. Thank you so much for coming.